Last year, we ended up doing mobile clinics where we went up into the mountains and just treated people right on the side of the mountain there.
It's 10 mLs.
I worked at the pharmacy station with another nurse, Pat.
You know what, I have a time limit.
We would see every single person pretty much who came to the clinic, and they would come to the pharmacy with not really a prescription, but a piece of paper saying what their diagnosis was and what the treatment was, and then Pat and I would figure out what the prescription was.
Twice a day.
It was pretty busy, pretty hectic. We treated a lot of the Chikungunya virus, which is a mosquito-borne virus. You get it from an infected mosquito that bites you. You develop high fever, severe joint pain, like debilitating joint pain, a rash. You're not going to die from chikungunya, but it's pretty awful for about 7 to 10 days. As far as treatment, you just treat the symptoms. So you treat the fever, Tylenol, Motrin, fluids, rest. That's really the only treatment. I developed symptoms about 2 to 3 days after we got home and woke up with a really high fever and severe joint pain. Could not get out of bed. The pain was so bad. Could barely walk. I knew right away at that point that I had it. And then a couple of hours later, I discovered a rash all over my body, and that's when I knew for sure I had it. Well, I knew what the treatment was. I knew you really just treat the symptoms. I did go to the emergency room because I wanted to get tested to know for sure that I had it. I did take some of the combination medicine that we had purchased in Haiti, which was a combination of Tylenol and a strong anti-inflammatory medicine. My experience with chikungunya, although it was probably awful for me, doesn't compare to what the people over in Haiti had to deal with. I was sick. I felt horrible. But I was in an air-conditioned house with a ceiling fan over me with all the medication that I needed, all the food, all the water, people to take care of me. And I did keep thinking back to the people in Haiti that we treated, because we would see them walk up a mountain, 95 degrees out, humid. God knows how far they walked to come to us to get medicine. And then we would give them a week's worth of medicine and send them on their way, and they would probably travel back down the mountain to their little hut shack that they live in, and they would have to suffer in the heat.